welcome everybody to the May 2026 Sharp Information Session. As I'm sure most of you know, we invite speakers to offer information about resources, services, and tools available to help English-speaking older adults to age in the right place. My name is Denise Beaton. I'm the Program Manager for Seniors at CHSSN. I'll be your facilitator for today's session. Thank you to all of the Quebec English-speaking community organizations, SHARP coordinators, and older adults with us today. We're very pleased to welcome Steve Guimond, CHSSN's Patient Navigation Network Program Coordinator. Steve will be discussing how patient navigation services can support older adults and caregivers in navigating Quebec's health and social services system. And he'll also share some practical tips and resources for accessing care in English. Steve Guimond was born in Chicoutimi, Quebec, and has spent all but 2 years of his life living in the province, mostly on or around the island of Montreal. Born from parents whose lineage was split equally between French and English-speaking ancestry, Steve and his family arrived in Quebec City in 2014 from Montreal after his wife was hired for a professorship at the Université de Laval. Steve was hired by CHSSN in 2018 as its first patient navigator for the Quebec City region. Outside of work, he's a family man first and is both a hockey and cycling nut. So Steve, thank you so much for joining, and I'll hand it over to you to share the quiz and your presentation.
Thank you very much for the introduction, Denise, and Megan for the support behind the scenes. It's a real pleasure to be here. I always look forward to these presentations. It's a great way to connect with the population across the province, particularly the English speakers, and also spread the news about this new service that is slowly being launched across the province, the Patient Navigation Network, that is going to be located in 12 regions very shortly across the province, based largely on the model of the patient navigator we built here in Quebec City that was launched in 2018. As Denise mentioned, I was the first patient navigator hired for at the time was a pilot project that eventually led into a full-time service. And I'll get into a little bit of the history of the project and service that we offered here in Quebec City, and then talk a bit about the network, and also give my sort of personal insights into my 8 years really being on the ground, largely accompanying English speakers through the health institutions here in Quebec City. Since 2018, we've served over 700 individual clients who had arrived in Quebec City. But when we factor in the return visits for that base of 700 individuals, we have over 1,700, we call them kind of accompaniments or interventions. So we have a large number of people to draw from and experiences, and many satisfied clients who've used the services here. So, and in terms of these polls, I put a lot of thought into them in terms of my experiences that I've seen over my 8 years as a patient navigator. So if we look at poll 1, what difficulties have you encountered in navigating Quebec's health and social services? These are all points that I actually witnessed firsthand with my clients during the 8 years that I was the patient navigator. Trouble finding my appointment location within the establishment, staff who refused to communicate in English, medical documentation I received was only available in French, and the instructions or information I received from the health professional were not clear. As hopefully most people know, as English speakers, we do have the right to be served in English in the institutions. However, what's often written on the paper is not what you see happening on the ground. If you look across the province, I mean, looking at Quebec City, where we are, it's a very francophone city. So the issues of particularly, well, I'm going to say verbal and written communication have been difficult. They've gotten a little bit easier over the years. We're seeing now in Quebec City a much younger generation of employees who are on the floor, particularly at the nursing level. Doctor levels as well. The doctors here, believe it or not, are for the most part bilingual. And I can attest to that, having met many, many doctors, as both a patient navigator, but also as a user of the system. And what's really interesting to see is at the nursing level, it's a really young generation that's now on the floor. And it's a generation that's much more comfortable communicating in English, even if not fluently bilingual. The communication has become a lot easier when you think of sort of that generation in terms of consumption of culture, traveling outside the borders of Quebec, and largely the international language of science and medicine is English. So I've seen many gains at that level. Big issue that really remains documentation, which is very hard to find here in Quebec City, once again, as an example. But the documentation itself, it actually doesn't fall under that purview of the right to receive services in English. It's almost like an exception. We always ask for it, we rarely find it. And that's one of the tips I'll get into a little bit later on in the presentation. So if you look at the poll results, we have staff who refuse to communicate with me in English. That's an interesting point, which is number one. I've seen that here, largely at the, I'll call it sort of frontline level, particularly when you're dealing with either admissions or registrations in departments. I've always found that that tends to be the most unilingual place in the institutions. Once you get closer to the doctor level, the bilingualism tends to increase a little bit. And in terms of refusing to communicate, my job as patient navigator, I was the intermediary. So I've come across those situations and I sort of would attempt to diffuse them. I never really saw any angry reactions. It was more just the staff person would just continue speaking in English, even though our mode of operation was always introducing who we were as a patient navigator, why we are there, why we are accompanying our client, who is a unilingual Anglophone. So more often than not, the conversation would continue with me for the registration or for the admission. I always had a big smile on my face. And there's a number of issues. The staff person might have a chip on their shoulder. They might be completely francophone. Once again, we sort of use different tactics to try and sort of alleviate the situation, make it a little bit more comfortable for everyone. So the patient navigator often comes in as that intermediary between the client and the healthcare staff in question, the liaison, trying to make sure that communication flows, even if it comes through us as the intermediary. We see instructions or information I received from the health professional were not clear. I have seen that in many cases as well. Unfortunately, patient navigators, we aren't medical interpreters. We aren't official translators, although there's sometimes situations that arise where it's a bit of a gray zone. What we don't want to be doing is interpreting results or post-surgery treatments or pre-surgery instructions. We really try to put that onus back on the institution because it is their job to make sure that information is properly understood by the client. So whatever means they have to turn to, if they have to go and try to find a bilingual staff person who can come and intervene. There are medical interpreters that exist across the province, but I'll use Quebec City as an example. These interpreters need to be contacted before the appointments happen with the clients, and it has to be done by the institution, not by the client. So for example, a client who has a communication issue in an institution, they can't request an interpreter on site, nor can the institution. There's no number you can call and get someone on and do it by phone. It's got to be done in person. But most institutions do not know that the clients they're seeing are Anglophones. They don't flag that, which would seem to be an easy solution to these blockages that do occur. Well, hey, we have an English person coming in at 1:45. Let's make sure that someone on the floor can communicate with them. But that does not exist, unfortunately. Whether it ever will, I'm not sure, but that in my mind would seem to be an easy solution. Clients often see the patient navigators as an ally. someone who basically has one foot in the system, but not working for the system, and one foot outside in the community. Largely, our patient navigators will be community or peer patient navigators. So there'll be navigators who understand the communities that they're working with, and they're able to relate to these clients on a community level, a one-to-one level. And they're not looking at their clients as just another case in the hospital or another appointment in the hospital. They're able to see the client as a person as opposed to just a user of the system. And they're able to translate the information they know about the system and the establishments and the institutions to their client. So ally also comes up a lot when we talk about the patient navigator and client relationship. What we've been able to do here is to, by whatever means necessary, make sure that information is properly transmitted to the client, whether it's the nurse having to write in English on the French instructions. We've seen that done. The odd case, we've been asked to translate. We try not to do that, but if it's an emergency or if someone is really stuck, we will do it. We have been able to sort of break down some barriers, and often it's just for asking for the information. I've seen many cases where I've been told by a staff person, oh yeah, that information does exist. Let me look for it. And they find it. At least it's getting into the pattern of asking for it and making the staff person aware that people will be asking for this documentation in English. So often it's just by force of knocking on the door continuously that these small changes have been made. And I think the more we do it, the more these changes will be implemented across the province. Often just by having someone with you who understands, it could be something as simple as the layout of a hospital. Where's the best place to park? Where's the cafeteria? What trajectory do I have to take? Often those aspects alone are enough to take some of the stress off of the shoulders of the users. Because often when we think of our client's health trajectory going into an institution, at the forefront of their stress is their medical condition, their medical situation. So that stress accounts for the largest part of their mindset on that day they're going into the institution. But then when you factor in other levels, for example, never having been to the institution before, am I going to be able to find someone who can communicate with me in English? I don't know where I need to go. These are just other factors that get added on. So the patient navigator gladly, as I did for 8 years, alleviates that stress and takes it on their shoulders. But it's not, we're just removing the stress because once we have the understanding of the layout of the city, the institutions, lodging suggestions, for example, for people traveling here, the overall experience that our clients have had has been also at the forefront of their satisfaction. Once people find out about the scope of the service that's being launched, as I mentioned, it's 12 regions across Quebec. Plus, we have 2 affiliated organizations joining us, so there'll be 14 regions covering the bulk of the population in the province. Once the information has been disseminated in terms of what this actual service is being offered are, how you can access them, I think there's going to be a huge, huge demand. We're already getting phone calls from people from across the province asking, oh, when's it starting? When's it starting? It will be soon. We're hoping by June 1st. The large majority of our new navigators will be operating, and they're going to be operating out of our local community, English-speaking community organizations are the CHSSN partner organizations, basically. And we'll look at the list of who these organizations are and how to get a hold of them. So as I mentioned, I'm going to be giving a little brief history of Quebec City's Patient Navigator, just because it's such a nice tie-in to this new network we're launching. And I'll call the new network, our acronym we're using is PNN, Patient Navigation Network, because CHSSN was one of the driving forces behind setting up Quebec City's patient navigator, and are also one of the driving forces behind the new PNN, largely by continuously making our presence known to different levels of government, be it federal, but particularly provincial, showing them our yearly statistics, sending them our annual reports, letting them know that the service is being used and how important it is. And we can really point to the results here in Quebec City, I would say largely for the launch of this new network. So this flyer that we see on the left, are you traveling to Quebec City for health services? This was our first promotional material we launched back in 2018. I was hired in February 2018. We launched the project, I think it was March 20th, so about a month later. We basically had a month to set everything up, decide what we were going to do, how we we're going to approach it. And it was largely with our partners in Eastern Quebec that this patient navigation service in Quebec City was launched. So are you looking for support while you are there? A patient navigator can accompany you while you're in Quebec City. So why Quebec City? Why did this happen here? I'm going to pull up a map of the province. That's the CHSSN Networking and Partnership Initiative map, NPI. If we look at Quebec City, which is the Capitale Nationale, the way that the system is set up in the province on the health side of things particularly is that anybody living east of Quebec City, so we have the Côte-Nord, the North Shore and Lower North Shore, we have the Magdalen Islands, Gaspé, and the Lower St. Lawrence. Populations living in these areas are more often than not sent to Quebec City for specialized health services. Well, why are they being sent here? Largely because in their regions, they do not have the types of services that are offered here in Quebec City, nor the types of services that they need. We are dealing largely with people coming from remote, isolated villages, small towns, and the medical services that they have access to are largely at the clinic level. The trend that's happening is that these regions are becoming largely depopulated. The young people are leaving. If you look at the Lower North Shore, a lot of the kids starting high school have to leave their villages because there are not high schools in every village. So they're being sent out. And then when it comes to the college level, the university level, well, they're gone. Largely coming to Montreal, Ottawa, particularly. So the services are being cut as a reflection of these shrinking populations. So we have people arriving here in Quebec City, sometimes for something as basic as an MRI. There's no MRI in Sept-Îles. There's no MRI in Blanc-Sablon. The Magdalen Islands has an MRI machine that's flown in, I think, every couple of months. And so they're able to get at least people done. Specialized health services can be anything from cardiology to oncology, gastroenterology, vascular surgery. So these are the clients that we were largely dealing with in Quebec City since 2018. I was going to switch now to a little video that we made to start of the service, advertising exactly what we do. Like, what does a patient navigator do? What kind of services do we offer here in Quebec City? And it'll be largely services that will be offered through this new network to the other regions across the province. If you're faced with a trip to Quebec City for health reasons, I'm the person to contact. My name is Steve Guimond. I'm the patient navigator in Quebec City. I provide support, logistics, and information for English-speaking Quebecers arriving in the city for specialized health services. In the last 4 years, I've seen almost 400 individuals from the regions that we serve. I understand the realities that people are facing when they arrive here in the city. So I've always put myself in the shoes of the people who are traveling here, largely coming from remote areas, remote villages. I'm very well aware of the kind of stress you face. So the services that we have set up here are made to make your trip easier.
Everything I hear back from people that have used Steve's services is extremely positive. They think of him as Super Steve. He reduces their stress when they come to Quebec City, and he gets people to their appointments on time. And not only that, he helps them access services in English when they need it.
When you're going out for healthcare from the Lower North Shore, you're going at a difficult time in your life. My mom and my stepdad are both elderly. My father has heart disease, and trying to navigate a very francophone system when you're unilingual anglophone is very hard. Steve has been a champion for them, and to them, he's become part of their family. My mother makes him wool socks.
Through my understanding of both the city and the healthcare system, I'm someone who can facilitate the communication with the healthcare staff, as well as any other leg of your trip. So if you're traveling to Quebec City, please get a hold of me in advance if possible. You can contact me through our website or call me. My phone is always on. That video was done in 2021, 2022. Just as a little reminder to our partners who had initially provided a bulk of the publicity to their communities. And when I say our partners, our NPI partners in the regions that I mentioned. So we have North Shore, Lower North Shore, Gaspé, Magdalen Islands, and Lower St. Lawrence. We had 7 partners basically getting the information out about the services. Largely through Facebook, largely through meetings that were held with their different communities, community members. We did a ton of radio interviews. I did radio interviews across the province, well, Eastern Quebec at the time. And it was really a great example of community. We're a community organization serving community members. And it was largely because of the community members that the service here was launched. We're going to talk a little about the history of the people, the actors behind the scenes who launched here in Quebec City, who are still involved in the project now. So who are patient navigators? They're your peers, representative community members. I mentioned this, peer-to-peer service. We are navigators coming from the community who understand the communities. It took me a while to fully grasp the areas where our clients were coming from. I did not know a lot of information about the Lower North Shore. I'd obviously heard the term, but then having met so many people from the Lower North Shore, there are roughly 70% of the users of the service are coming from the Lower North Shore. I was able to grasp the fact that in the winters, most of the people get around on snowmobiles because there's no roads. They'll travel between villages on, they call it the Route Blanche, their white highway, which is a snow highway that links a large part of the Lower North Shore. So I had no idea. I mean, that was completely new. So I learned to understand the community, and was largely by spending a lot of time with people from the Lower North Shore, but also from the Magdalen Islands. Magdalen Islands, incredible place. If you ever get a chance to visit, please visit. 14,000 people live on the island, and there's a small population of about 700 English speakers, largely centered in one community called Grosse Île. I had no idea. And now I've met hundreds of people from the Magdalen Islands, and particularly Grosse Île. So these are the communities we deal with. I was able to understand them by meeting them. And once again, as I mentioned earlier, I think it's important that navigators are coming from outside of the system, because they don't just see the clients or the patients as just another number. I mean, we're able to relate to them on a personal level, on a peer level. Patient navigators, calm, cool, and collected. We are responsive and reactive. We respond to the needs of our clients. And the reactive part is reacting normally on the ground to the situations that arise. Be it, our client needs to get a prescription filled. How are we going to do that? Where can we send them? Can we help them? Our client has been told that they have to stay in Quebec City for the next week. Okay, how are we going to approach that situation? So we respond and react to our client's needs. So we have one foot in the system. We're an insider and a companion. I'd also mention that as well. So one foot in, one foot out. And we're supportive allies. As I mentioned before, and it came up in the poll, I think the most important part of what we can offer is being there for the client and providing very important moral support. A lot of what we do is about advocating for our clients, but it's also giving them the tools to empower themselves and take control of the situation once they're getting into the institution or if they're dealing with the different health and social services institutions. So where did this all get started? It got started largely on the Gaspé, particularly through the work of Kathy Branham and Kim Harrison, who worked in CASA. CASA is the English-speaking organization out of New Carlisle. It's one of two English-speaking community organizations in the Gaspé. The other one is Vision, which is located in the town of Gaspé, and New Carlisle is on the Bay de Chaleur. So Kathy Brown has been a long time champion for English-speaking rights in the province. And it was based on studies that they had started way back in 2006 that told them that clients who were traveling to Quebec City for health services were having trouble, particularly at the communication level and the language level. I'm going to show you a quick video extract that was prepared for CHSSN's 25th anniversary last year, where Kathy speaks a little bit about her ideas behind patient navigation.
In 2006, CASA asked Canadian Heritage for project funding to do an extra regional project. Because we've heard in our communities that when patients leave this community, this region, for health services, they were really struggling with English services. And yet the system told us that that wasn't true. We hired a consultant who literally went to different hospitals off the coast and asked for service in English. We found that the lack of English services throughout Quebec outside of the Gaspé were atrocious. So I phoned CHSSN and said, we got a problem. And from that, I'm really, really proud that the patient navigator was the result.
Alan, Gaspé now has its own patient navigator.
Yeah. I interviewed Jim for a tourism job. He knew nothing about tourism. Yeah, wasn't going to get that job, but he was a former paramedic, perfectly bilingual, newcomer to the area. And as I was driving home from the interview, I was thinking, wouldn't he make a great patient navigator?
Here we are today. We're negotiating with the provincial government right now to finance for 5 years patient navigators in multiple regions across the province of Quebec. And you know what I love about this project? It incorporates everything about what CHSSN has been trying to teach communities since the very beginning. Build your knowledge base, become a part of the solution, make partners, use the strengths of your partners to respond to the needs of the population. We came into this business kind of taking a model in Quebec City that was working, trying to figure out why is it working and how can we bring that to other communities across the province. We learned in the process ourselves. We didn't get handed a manual. We had to kind of create the manual and finding champions in your partners.
So what are you going to do in the next 25 years?
Oh, wow.
So that was a video that was done for CHSN's 25th anniversary. And Kathy Brown was the one in the glasses. Alan is the current director of CASA. Kathy is the previous director. And it sort of points to what we saw and what we heard from other communities as well who are forced to travel here. When you think of someone coming from the Gaspé, coming to Quebec City, largely we saw people arriving by bus because the region would not provide plane tickets as they do on the lower North Shore. So we saw cases of people traveling upwards of 12 hours to arrive in Quebec City for appointments. The bus arrives, there's one bus a day. It arrives around 8:30 at night in Quebec City. So we would see people, I saw a woman who was 85 years old who got off the bus at 8:30 at night. When you think of what people have to go through to get the basic services, that's why this service was launched. Kathy mentioned the 2006 study. There were also studies done in 2012 through 2016 on the lower North Shore that pointed to the exact same things. So it was because of our partners in Eastern Quebec, CHSSN, brainstorming, coming up with this project based on the needs of the community that came directly from these studies and surveys. So we launched the pilot project here in Quebec City. Initially was supported by CHSSN's foundation, the Quebec Community Health and Social Services Foundation, largely. And over the 8 years of our existence in Quebec City, the funding has come from different pockets, some from our CS here, some from the federal government, a little bit from some of the foundations associated with the hospitals here. But now, as Jennifer had mentioned, Jennifer Johnson, our director in that video, this new project, the PNN, is being financed for at least the next 3 years by the provincial government. So we finally have stable recurrent funding, which is something we've been looking for the last 8 years. And so why did this all get started? Well, many Quebecers, and not just on the Lower North Shore or Eastern Quebec, they face both challenges of navigating the complexities of the provincial health system and the stress of the medical situation. Patient navigators represent a significant step towards addressing particularly persistent linguistic barriers faced by English speakers when accessing care. As we know, language plays a fundamental role across the entire continuum of healthcare, serving as the main channel for communicating symptoms, diagnosis, treatment, planning, and following medical instructions. Clear communication, especially when delivered in a patient's preferred language and in plain terms, is closely associated with greater safety, fewer medical errors, and improved health outcomes. As Denise mentioned off the top, I consider myself a completely bilingual Quebecer, but my first language is English. And when it comes to certain aspects of my daily life, I'm much more comfortable communicating in English when it comes to certain things, whether it's legalese or medical. Those are particularly the two that sometimes the terms that pop up, I may be somewhat familiar with them, or they might just fly over my head. So thus the importance of communicating in English when we have the right to. What outcomes do we see for patients using patient navigation services? And these are based on a survey that was done of our service in Quebec City back in 2021, but they all line up with other surveys and evaluations that were done of different patient navigation services across North America. So better access to travel, healthcare, and medical information that patients need in English, reduced anxiety about traveling to Quebec City and receiving specialized medical care, a better overall experience of being in an unfamiliar city and in an unfamiliar hospital where French is the predominant language, better access to English language services, and improved health outcomes according to the interviewees. So these are all outcomes that the interviewees, who are users of the patient navigation service in Quebec City, told our evaluators. But there are also outcomes for other stakeholders. So the experience of working with English-speaking patients is improved when these patients receive support from the patient navigator. The Patient Navigator Project has raised awareness of existing English language healthcare services, and the PN project has raised awareness of the need to provide English-speaking patients with English language services. Now, and this was largely through us just being on the ground. When you're going into hospitals on a daily basis, you tend to see the same people who tend to ask, oh yeah, who are you? What do you do? And it makes them aware. And they will start contacting you when they have an English-speaking person if they're stuck. This is directly here in the hospitals. Once word of the service got spread across the province, we were getting phone calls, and we still are, from social workers, clinical nurses, community healthcare centers as well, contacting us directly, putting us in touch with clients who are traveling in Quebec City. And unanticipated outcomes that we found for our service here in Quebec City was increased patient compliance with physicians' directions and improved continuity of care provided by regional healthcare providers, and cost saving for both the regional CHSSN and for patients traveling from the regions to Quebec City for medical care. I'm more impressed with the first one, the increased patient compliance, and this is other studies have also found this. If the patient or client understands their situation better and understands what they need to do, well, then they're able to better follow their course of treatment or their instructions that they've been given. So it leads to less reuse of the system for no reason, and ultimately improved healthcare for users. So I'll talk a little bit now, more importantly, I think, about this new Navigator network. I have become the coordinator for the Patient Navigation Network. And this is a first glimpse of our new branding for the service that is going to be available very soon. Everything is just being finalized and approved. So having difficulties trying to navigate Quebec's health system, do you need support for a medical appointment? A patient navigator can accompany you. So patientnavigator.ca is going to be the website that is going to encompass all of our network, so our 14 regions. And then each region will be advertising locally using largely this branding, these graphics materials. We're going to have posters and we're going to have rack cards that are going to be spread out across all our different regions. This is a glimpse of the new Patient Navigator network. We have, there are only 11 organizations here, but there are actually 12. We added one in Montreal, which was not going to initially be part of the network. And the reason being is, given the complexities of the island and the large population of the island, we found it, I think, too daunting to have someone in Montreal. Well, where do you put someone in Montreal? I mean, there's so many neighborhoods, so many institutions. After rethinking the plan, we partnered with our organization in Montreal East, RISA. So they're going to be providing services for Montreal East and North. So they're not found on this list. So if we look at the 11 other regions, we have the Outaouais, so the Connections Resource Center will be leading the project there. In the Laurentians, we have Four Corners, Lanaudière, the English community organization of Lanaudière École. Then we have 3 organizations in the Montérégie West, MWCN, Montérégie Centre, the Assistance and Referral Center, ARC. We have Montérégie Est, the Montérégie East Partnership for the English-speaking community, MAPEC. Then we have the Townshippers Association in Estrie. Here in Quebec City, we have the Jeffrey Hill Community Partners. The Lower St. Lawrence, we have Heritage Lower St. Lawrence. In the Saguenay, we have the English Community Organization of Saguenay-Lac-Saint-Jean, ECHO 2. And finally, on the North Shore, we have the Coasters Association, who are going to be offering the services in both Baie-Comeau and Sept-Îles. And they'll be seeing largely a split between people arriving in Sept-Îles or Baie-Comeau for health services from the rest of the Lower North Shore, because often Sept-Îles is used as a either a first stop before other stops in someone's health trajectory, or they're often used for consultations and more generalized appointments. So they'll be seeing a lot of people arriving. Thus, we're calling them an interregional patient navigation service, much like Quebec City, because we see people arriving from outside of Quebec City. And then there is a third interregional patient navigation service that's going to be in Rimouski, so the Lower St. Lawrence, because Rimouski sees a lot of people arriving, particularly for oncology, because there's a huge oncology center there. So they see people arriving mostly from the Gaspé. Quebec City oncological services are not, for the most part, used by Gaspé residents. Yes to North Shore and Lower North Shore, but the Gaspé residents are sent to Rimouski because it's a much shorter distance for them to travel and come into Quebec City. Now, all of our other partners are regional patient navigators, regional patient navigation services, focusing on the local population. So we have that differentiation between the interregional patient navigation services and the regional patient navigation services. So what is a patient navigator? Patient navigator is a person who provides support for navigating the challenges and complexities of receiving healthcare. For patients and their loved ones, this can be helpful as you undergo medical appointments, tests, or treatments, as you find a way around the medical establishments, or as you communicate with health personnel, and as you deal with decisions and emotions. A patient navigator can help improve access to health and social services in English, increase access to medical information in English, meet you at the hospital, accompany you, when needed, communicate with healthcare staff, access local support services, reduce stress levels, and advocate for patients' needs and rights. So largely, this is what our patient navigators will be doing in the 14 regions that will make up the patient navigation network. Oh, on the map, I forgot to mention. So we have James Robson, who is our Gas Bay patient navigator. He was in the video. He's amazing. He's been running the service there now for the last 3 or 4 years. He handles pretty much all the Gas Bay, and he was doing a large number of trips to Rimouski to accompany people. So he would, I think it's like 3 hours to Rimouski and then 3 hours back, if not more. So he would actually meet people in Rimouski and help them for their initial visits there. And we also have Laval. Laval through Agape have been running a patient navigation service for the last number of years, but it's only been phone. So they would have a phone number that someone can call if they had questions related to their health situation. But they're going to be taking it one step further very shortly, and they'll be offering in-person accompaniment modeled largely on the other patient navigators. So we're going to be launching the network shortly. Already, I'm going to say now over half of the network's patient navigators have been hired. The website will be patientnavigator.ca. It's being finalized right now, and it's going to have basically general information about patient navigation and the services that are being offered. And then each of our organizations are going to have their own page where they'll be advertising their own proper services. So what they're going to be specifically offering, who their patient navigator will be, and what is the best way to get a hold of them. And then if you are anxious, you can contact your local English community organization for kind of more up-to-date information on the services that might be available in your area. Because this program was really only finalized, believe it or not, in late 2025, we got the confirmation, I'm going to say maybe 7 to 10 days before we shut down for Christmas. It's been unfortunately a bit of a scramble to get things up and running. We had to basically create all of our documentation, not necessarily from scratch. We had to create training manuals, a program overview. We had to finalize a code of conduct for new navigators. And then it was approaching the navigators, working out our budgets, approaching our community organizations who we're going to partner with. Then they had to hire someone to replace me because up until the middle of February, I was both trying to coordinate this new network, and at the same time, I was offering the patient navigation services in Quebec City. So I've been now full-time concentrating on the project for the last, I'm going to say 2 months. But things are moving ahead, and we're hoping probably by June 1st, all the navigators will be hired. So if you do have any questions for your specific regions, the regions that I had mentioned in the previous slide, I'm hoping most people have that direct contact with the community organizations, and you should be seeing information coming up from them already. I know I've seen different postings, announcements, etc., etc. For example, Connections, I got an email on Friday from the executive director. She had done an interview with CBC talking about the services, so the word is getting up there. And if you want to call me, my phone's always on. I have a lot of the answers for what's happening. 418-572-3385. That is my direct number. And once again, just to go over the networks so people are aware of who the English community organizations are in their regions: Jeffrey Hill Community Partners in Quebec City, Heritage Lower St. Lawrence in Rimouski, the North Shore Community Association in Sept-Îles and Baie-Comeau, Four Corners in Laurentians, the Assistance and Referral Center in Montérégie Centre, the Connections Resource Center in the Outaouais, the English Community Organization of Saguenay-Lac-Saint-Jean, that's in Saguenay, English Community Organization of Lanaudière, obviously in Lanaudière, Montérégie East Partnership for the English-Speaking Community in Montérégie East, the Montérégie West Community Network in Montérégie West, the Townshippers Association in the Eastern Townships, and in Montreal, the East Island Network for English Language Services in Montreal East, and they'll be also doing some navigating in Montreal North. And then the two networks who are going to be affiliated to us, and they also They both currently offer patient navigation services. The Committee for Anglophone Social Action in the Gaspé and the Youth and Parents Agape Association in Laval. So that is our 14 network strong organization. Tips for navigating the Quebec healthcare system. Know your rights. If you're an English speaker, you have the right to receive healthcare in English. So in Quebec, healthcare is often called health and social services. Where and how English language health and social services are offered depends on factors like available facilities, human resources, and budgets. And that's almost like anything else offered in Quebec, unfortunately. If you want these services in English, please be sure to ask for them. However, more restrictive rules apply to accessing your medical record or other health-related government services in English. The important thing is to ask for them. I'm going to use a lot of the clients who we've seen in Quebec City. I always got the impression they were afraid to ask the questions, particularly because of the language issue. They were afraid to speak up for themselves. They didn't want to ruffle any feathers. But when it comes to one's health, it's too important. Make yourself uncomfortable, stand up for yourself. Not in an angry way or a mean way, in a forceful, positive way. My modus operandi, particularly at the end of my tenure as patient navigator, was staying positive. It was talking myself up before I got into the hospital. Because I was in hospitals on such a regular basis, and the hospitals here, particularly since COVID, I'm not going to say disappeared, particularly since COVID was not as much in the headlines, the hospitals in Quebec City have become overrun. It's even difficult trying to find a parking space. There are more and more people in the hospitals. So the hospitals themselves have become imposing. Well, they've always been imposing for many people, but imposing in the numbers of users. You see it, you feel it when you walk into the hospitals. It's like a heightened anxiety, a heightened stress. So I always prepare myself because I went through a bit of a burnout phase during COVID for a number of reasons. And I think I was not properly mentally prepared. And I made a switch to keeping the positive attitude, having a smile on my face, using the stairs, not in the elevators. Also putting myself in both the shoes of the users and also the staff, because you see the staff being overrun and you see the staff burnout internally. I mean, I had seen situations where at lunchtime coming across a group of nurses having lunch in a kind of a quiet area, and a couple of them were in tears, not communicating with each other. So having that attitude will only help you when you're approaching the situation. The patient navigators will be there as an ally, but we're trying to empower people as well, and not leaving them for themselves, but also just giving them the tools for potentially the next time they're going to an institution and they don't have a patient navigator or anybody accompanying them. So ask for it because it's your right. And the more you ask, the more the staff is aware. I had mentioned that, but it's also, chances are, and I see here in Quebec City, which is way more francophone than many other regions that we're serving, often you're going to come across a staff person who's going to be excited to communicate with you in English. Quebec City, a lot of people who are bilingual or who are working towards bilingualism on the French side of things don't get the chance to communicate a lot. So I've seen it where, oh, wow, English. Okay, let's talk English. Even though they might have a bit of a broken English, they're excited and they're happy. So those situations do arise as well. So speak up. Don't be afraid. Advocate for yourself or for others. If you're accompanying someone, do the same. Ask the questions. Request that English documentation. The health system is not aware you might be more comfortable discussing or receiving this information in English. But I mentioned this as well, and I come back to this, it falls on the institution to accommodate you, not vice versa. As frustrating as it might be, running into the barriers, the next time you go, the barrier might not be there. It really is case by case when it comes to the situations. Unfortunately, there's no golden rule or golden path we can send our users on. That doesn't exist. But just by continuously knocking on the doors and asking, things do change, albeit sometimes slowly. I also suggest please write everything down. I always carry my own logbook for my clients. It's important to keep track of the information that's being relayed to you. And also, please, before you leave your appointment, go over what you have written down and double check it with the professional to ensure that you have understood everything correctly. Because once again, it's up to them to make sure that you're leaving with the information you need, not vice versa. And if it means them having to go find someone, I've seen it where a nurse will be switched off because the nurse who has been assigned to our client is not comfortable enough. So they'll actually make the effort to find someone on the floor to come and take their place. And please remember, so my experience of having navigated hundreds of English speakers within the institutions and hospitals, rehabilitation centers, at the heart of every interaction, it really is the patient. The system, as I said not long ago, is overworked and overburdened. The staff, though, will do their utmost to accommodate you. Once again, I know with a lot of the language issues that have arisen over the last couple of years, you have what's written by the government, but the realities on the ground that I've seen is that at the heart of every appointment, of every surgery, it is the client and it's the client's well-being. Yes, you might have experienced coming across an employee who didn't look happy, might have snapped at you. That does happen. I've seen it. I've been snapped at. Once again, I have my smiley face on, but I can understand potentially why. But those occurrences have become less and less, particularly over the last couple of years, because we are blessed with staff who are dedicated to their job. And at the heart of their job is the patient. So it has gotten a bit easier. There are setbacks, but I do see it all in all, overall, as a system that's slowly moving forward. So, and that would be the end of my presentation. My thanks to the CHSSN, who took a chance on me. My background was not in health and social services. It was complete 180 degrees from what I'm doing now and what I did for the last 8 years. I think I was hired because of the type of person I was, and having trained now half of our new navigators, the types of people have been hired are the kind of people we want being navigators. It's people who, first and foremost, can communicate, they can understand, they can provide empathy and support, and not sympathy. Empathy is putting yourself in somebody else's shoes. So they can put themselves in the roles of their clients, but also the roles of the professionals. I learned my job really on the ground. We built this project from the needs of our clients, and this new program and new network will be built based on the needs that our navigators are going to see. We're very excited about it. And I really want to thank Denise and Megan for inviting me and helping spread the word about our new network.
Yeah, thank you so much, Steve, for your presentation. It's clear that there's so much information and knowledge there from your 8 years, and it's just incredible how this program has grown. Let's get into some questions here. So the first one in the chat is, will the Magdalen Islands be served under the Gaspé region? Are you aware of whether or not that's the case, Steve?
No, unfortunately, no. The Gaspé service has been up and running for a number of years now, based out of New Carlisle, but James Robson travels the region and he does make the trips to Rimouski, but he'll stop doing those once our navigator's hired there. But unfortunately, on the islands themselves, no. But the islanders who are going to be traveling to any of the regions that we had talked about, they have access to those services, even though they're coming from outside. But like I mentioned, I'm going to say roughly 15 to 20% of the users of the service here in Quebec City are from the Magdalen Islands.
Will the program continue to run as it has in the past? I'm wondering if that's probably about Quebec City. And Steve, I think you can answer that. Yes.
Yes, we did hire someone to replace me, and he was hired at the end of February. We did 2 weeks of training together on the ground, and he's taken over my duties as of mid-March. It's the same phone number, 418-932-0095. Instead of getting Steve on the line, you get Anand. Anand Narain is our new patient navigator here in Quebec City.
Okay, great. And then I have a couple questions. So based on your experience, what are some of the most common situations where people realize they need help navigating the system?
Oh boy. I mean, given the size of the institutions, it's gotten a lot more complex, sometimes even just navigating, particularly if we've never been to the institution. In Quebec City, because people were coming from smaller areas where they were used to being seen in a clinic, so, two-room clinic. The major hospitals they had, Sept-Îles is 2 floors. Blanc-Sablon, I think, is 2 floors. So when you come to, for example, Enfant Jésus, which is being built up now to be the super hospital in Quebec City, it was already very imposing before they started the expansion, and it's even gotten more imposing. So just navigating internally, and it was communicating with the frontline staff were very, very difficult to find someone who can speak English or even communicate at an effective level. That's where we made our greatest connections, because we would often see the same people. If you're going to, at the time, to get a hospital card, we don't need those anymore, thankfully, but you would see the same people at the admission. Or if it was to be admitted for a surgery, you would see the same people there. If it was in certain departments, they were going to on a regular basis. When they saw us come, they were a big smile on their face, because now they would be able to make sure the client knew the instructions that they had. So it was really at that sort of more introductory level to the institutions where we made the greatest difference and saw the biggest blockages. Sometimes too with the nurses, when someone was going in for a procedure and the nurse didn't feel comfortable enough sort of initially getting the ball rolling, we would be asked to stay to just give the basic instructions to the clients. Okay, this is what's happening throughout your day. Now we're just going to do your vitals, get changed. This is where your locker is. And then very important too is the filling out of French medical questionnaires. So for usually the first visit, there's a questionnaire, or for certain procedures, there was a questionnaire that would pop up and be given to the client, and it was in French. So do you have this form in English? No, I'm sorry. So then we would sit down, obviously making sure the client was comfortable, that we'd be able to fill it out with them. So we would ask the questions and then put the answers down, because it was all in French. So,
Steve, do you ever have a volunteer to assist for the patient's appointments?
volunteer, we got quite ambitious when we launched the project before the phones really started ringing, and we tried to build a volunteer base. But because for the 8 years of the service, it was only me, and as the service became busier, we were never able to fully get it off the ground. We were hoping to get some volunteers, but then there was also the Jeffrey Hale here in Quebec City, who had their own volunteer service that sort of mirrored ours a little bit, particularly for transportation. No, it's always really just been more of a personalized service by myself, and then now Anand here. And I think the personalized service helps because as we know the institutions and we understand, we're often going to the same departments and seeing people go through the same procedures. So we even become quite familiar with the trajectories of someone. So we can kind of give tips too in terms of, things they should be kind of looking out for. Obviously, sort of non-urgent, falling more into the kind of gray zone that I had mentioned earlier. So in terms of what's going to be happening with this new network and volunteers, I mean, I know a lot of our organizations already have a pretty strong volunteer base. I think it'll just be seeing what the response is when the service is launched and seeing how great the demand is and how that demand can be met with, I guess we'll call them the budgetary restrictions for each organization. And we're giving the organizations a lot of leeway to sort of really take this service where they want to take it. So whether that will mean recruiting some volunteers or having other staff members get involved, we'll see what happens. But I mean, it's a great idea. But for our service in Quebec City, I mean, when I left or I wasn't available, the service shut down because we didn't have anybody. We had no part-time. We didn't have the budget. Like we really kind of scraped by for 8 years, year to year. So
do you need some medical knowledge in order to translate for the patient? Is that something that you look for in a patient navigator?
Off the bat, I'm going to say no, because I had mentioned in the presentation, we're not medical interpreters. That's getting it to some very kind of risky and tricky areas. It's not our job. It's the institution's job. Where we step in is by being on the ground and being with people and sitting in on appointments, and you pick up certain things. So if it's like looking at a pre-surgery instructions, well, we can maybe help with that. You need to buy these 2 sponges. This is what you need to do. That's sort of pretty safe. But we really can't do much more than that. Once again, if it comes to sort of more translating anything to do with a diagnosis or a treatment, getting more into the finer details, we can't touch that. I did, and I'm hoping that our navigators will push themselves in terms of looking into opportunities. I was able to do an introductory medical interpreter program, but very introductory. I also did a patient navigation certificate. So there are opportunities out there, but there are specific medical translators that exist, interpreters that exist in Quebec. And it's really different region by region. I've heard through some of our organizations and new navigators that even sometimes within an institution, there'll be an interpreter. So that's something to really explore, probably more at the local community level. I explained the procedure here in Quebec City where it has to be called in advance. And over my 8 years, I had one client who had an interpreter show up. And the only reason why is because when he made his appointment, he was asked if he wanted a medical interpreter. He said yes. But he's the only client I ever saw over 8 years who was asked that question. So once again, a large part of these problems are caused by the system, but they don't have the solutions. I sort of look to the role of the patient navigator as sort of filling those gaps where we can.
Okay. All right. And then another question around outside of accessing the physical structures, would patient navigators offer help with accessing the government's new digitalized system, which has been changed and is no longer Clic Santé? Our seniors struggle immensely using digital technology. So in your experience, is accompaniment more so for in-person appointments, or is there a digital systems component?
I'm going to say less of a digital systems. It's really more of either in person or, for example, trying to clarify certain information around appointments where we've been told by some of our clients over the years, well, this message was left on my phone, it was in French. Can you listen to it for me and maybe help me decipher? It's about someone waiting for a phone call for their surgery the next day. The phone call never comes in, so they would ask us to call the pre-op department and find out, verify what time they're actually supposed to be there. I think unfortunately, when you kind of either look to the digital side of things, but also to the sort of the helping people make appointments or try to navigate that system, unfortunately, I think it takes away too much time from the services that we're trying to offer, which is more of an in-person accompaniment aspect. But because our navigators are associated with our English community organizations in their regions, a lot of these organizations will also have potentially tips and tools to maybe tackle that aspect.
Okay, wonderful. And then there's a question around, will we be receiving publicity soon so we can start promoting the services? I think that's likely on an organization by organization basis. And then I wanted to end with the last question since we're almost at time. What do you recommend we say when asking for service in English?
Introduce yourself. Explain that you are, explain your situation. I am fully bilingual, but I appreciate having health information provided in English. I do not speak any French. I will need to be accommodated. It's explain your situation, be upfront, be honest, say it in a friendly way. If you can sort of use that tip, instead of putting yourself also in the shoes of the person you're talking to. It could be someone who is ending, an overtime shift. Could be someone, who's had a bad day. But I think it's really about being upfront, and making sure that communication happens at the start, right at the start. Don't wait until you're an hour into your trajectory. As soon as you walk in, state your case, and at every step, because often our journeys are more than just one step.
Okay, so something like, "Hi, I'm Denise. I would appreciate our discussion be in English," like that. Yeah,
something like that. Or if you can communicate a bit in French, present yourself in French, which is generally the working language. Bonjour, je m'appelle Steve Guimond. Je me considère plus ou moins bilingue, mais quand je me trouve dans une institution de santé, je préfère que la communication soit en anglais. Je suis plus confortable déchiffrer les informations en anglais. And that's what I would say. That's what I would say for myself.
Well, thank you so much, Steve. And thank all of you for being here today. I hope today's session has provided you with useful information, practical tips, and resources that you can also share with others in the community. I'm sure you'll be hearing from your local organizations around the patient navigators that may be available in your community. And thank you to our SHARP community coordinators for the important work they do across Quebec. Thank you to Megan for providing technical support for today's session. And finally, on behalf of all of us, a huge thank you to Steve for this informative and engaging presentation and for the important work being done through the Patient Navigation Network. Please keep in touch with your local community organization to learn about upcoming SHARP sessions. As always, thanks everybody for your participation and support, and we'll see you in June. Okay, have a great day.